Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUAM News Extra. Low back pain is a common disorder that affects 80% of people at some point in their lifetime. So if you have lower back pain, you are definitely not alone. It is estimated that each year Americans spend a whopping $50 billion on low back pain. It is the most common cause of job-related disability, and it's a leading contributor to missed work. Dr. Jitka Lom from Express Care joins us now to tell us more about this disorder and how you can prevent as well as treat it. Thanks, Doc, for coming in. So what are some of the most common causes of lower back pain?
Well, Mindy, I think the most common cause for people under 45 is sprain and strain. Carrying heavy things, improper lifting techniques, those would be the top two. Sometimes injuries related to trauma, for example, a car crash or sports-related injury can also affect it. So we call that mechanical low back pain, where basically through the activities of your life, daily living, or your hobbies, you experience an injury to the back and suffer pain.
Now, how should you treat or manage lower back pain?
Well, it depends a little bit on the cause, but of course prevention would be the ideal. But if you've already got low back pain, as long as it's not radiating down your legs or affecting your gait, your ability to walk, or ability to urinate or use the restroom, then it's safe for you to try some anti-inflammatory medicines, over-the-counter things like ibuprofen, that would be Motrin or Aleve. You can try those medicines. Taking them regularly, about every 6 hours, whether or not you have pain, because they're taking down the inflammation in your lower back muscles. And that's the common mistake people take. They just take one or two and expect that to work. And you need to take it regularly for a few days. Then making sure that you continue to stretch your low back so the muscles don't get stiff. And then avoiding the injury that affected it in the first place would be important.
Now, you mentioned prevention, and that's probably key. You always hear bend at the knees, things like that. What can people do to prevent lower back pain?
You know, I think what I see, the number one thing I think you can do to prevent lower back pain is to strengthen your core. That would be the abdominal muscles in the front of your body. Our back muscles work in conjunction with our front muscles. We have the spine, the bones in the middle, but we have the abdominal muscles in the front and the back muscles, very large muscles in the back. And if there's an imbalance, your back muscles have to work much harder to keep you standing up. Your tummy is soft and flabby, and you're going to start developing low back pain. A second thing that you can do is to keep your weight down. If you're, again, carrying a heavy belly in the front all the time, you're going to be putting strain on your back. And then maintaining your flexibility, so making sure that you do your stretches prior to your sports or work activities, minimizing the improper lifting, like you mentioned, so that you don't have repetitive injury to your back.
Okay, now how does aging affect lower back pain?
Well, over so many years, we're standing up, gravity is pulling down on us, we're carrying heavy things, and we get wear and tear on our spine. Our spine bones, the vertebrae of our spine, are stacked upon each other like blocks, and basically if we're constantly twisting, turning, bumping them, there's wear and tear, and we develop little bone spurs on our spine, we develop some arthritis there, and then we develop pain from that.
And we were talking a little bit earlier, and it's a tongue twister for me, but let's talk a little bit about spondylolisthesis.
You did great. That's a really hard word. Spondylolysis and spondylolisthesis. These are conditions where there's actually a fracture, a stress fracture, meaning a break in the vertebrae. So your vertebrae looks like a little block, okay, or a little round block. And then there's a little spine that comes off of it, and that's what you feel when you're touching down the back of your spine. And that little spine that comes out can break from stress injury. So for example, from gymnastics, from rugby, from football, typically in younger people, from a car crash, there can be a crack between that spine that sticks out and the main body of the vertebrae. Now that's unstable. That means that vertebrae, that block of bone, can shift forward. We call that spondylolisthesis, where it's no longer attached to the proper place, and now there's instability and wear and tear on the spine. So that's something that can be figured out through X-ray.
Okay, one last question before we throw to break is, how can you tell if your pain may be something more serious than just a sprain or strain, as you mentioned?
Two really important factors. If you have low back pain that is continuing during the nighttime, you need to have it checked because that is unusual. You should not have much back pain when you're sleeping. Second thing is if you're having low back pain that's radiating down through your buttocks, down to your legs, or especially your toes, if you're having trouble with numbness or tingling or weakness in the legs, that's very serious and needs to be checked.
Okay, sounds good. Well, we've got to take a break, but Dr. Lom will take viewer questions on lower back pain when Healthy Living returns.